I'm Dr. Russell Raath, and as always, I hope you are living fantastically. In today's video, I'm going to discuss the question, vitamin drips, do they work? Currently, people are looking for and trying anything they can get to improve their immunity so that to increase their resistance to infections. Now, there are many ways to boost your immunity, and I'm not going to discuss them all today. I will discuss them in subsequent videos. But today I want to discuss just one issue, one method that people are using to boost their immunity, and that is vitamin booster drips. It seems to me that the people are flocking to areas where they can get vitamin booster drips in an attempt to improve their immunity. But the question I want to ask, again, do they work? Well, before you can answer the question of do they work, you have to first decide what is work. How would you know they are working? Well, you're taking them for a specific purpose. So is it achieving that purpose? And the purpose is it increasing your immunity? So that's the first way you have to determine, is it working? Are they improving my immunity? Secondly, am I getting value for money? I mean, the money I'm paying for this vitamin booster drip, is it raising my immunity? If so, to a amount that is sort of fits with the amount of money I'm paying for it. The trouble is, it's very hard to determine if your vitamin boosting drips are working. Why? In order to determine if a thing is working, you have to test your immunity baseline, have a drip, and then see what your immunity does. Problem is, there's no objective way of checking and testing your immunity. So how would you know if they're working? I mean, you don't know what your immunity is. You take the drip, you don't know what your immunity is. There's no absolute objective test of whether your immunity has improved or not. So how would you know if this drip has worked? All you can do is wait and see if you get sick in the next flu season. If you don't get sick, well, it could have been the drip, or maybe you weren't going to get sick anyway. What happens if you do get sick in the next flu season? Then you know for a fact the immune booster drips did not help. That's a long way of finding out if this thing worked or not. So it's very difficult to know if it worked. There are many products on the market that promise to boost your immunity, and you've got no way of testing it. The only thing that you can do is to do your own research. Google is a wonderful thing. Find out, read up about various products, various substances that promise to boost your immunity. Some have been researched. Some are just making empty promises because they've got no way of measuring it. And you have to find out the products that are most likely to help, that make the most sense. And the products that have been at least researched, that there is some medical literature on them. And then you have to do whatever you can to raise your immunity. Now, as I've said, there are many ways to raise your immunity. Just a healthy diet, one of them. But also, apparently, vitamin drips. Again, do they work? Before we can understand if they work or not, we have to first decide first understand what is a vitamin. Now, when you want to improve your immunity, you have to build up your immunity. Let's just, for argument's sake, to make it easy, there has to be a certain chemical or product in your immune system that improves your immunity. This product is made up of two other chemicals. They have to react with each other, combine to form this one. That's a chemical reaction. Now, some chemical reactions do not take place easily, and so they need help. And the help is usually a catalyst. Now, a catalyst helps the chemical reaction to get going, or maybe maintain it, or make it flow, or react easier to produce this product. But it does not take part in the reaction itself. In other words, we've got these two chemicals, they're reacting to this, to form this chemical. The catalyst helps that process, but doesn't become part of this final product. It's like when a young man introduces his best friend to his sister. Now you've got best friend, sister. They get married. The brother doesn't become part of the marriage. He was just a catalyst. He introduced them to each other and maybe encouraged them, and they got to know each other and eventually got married. He is not part of the marriage. He is outside. He was just the catalyst. That's what vitamins do. They do not become part of your immune system. They just help the process of building up your immune system. From that, it becomes obvious that you need these chemicals to make this one. You can have all the vitamins you like. If you don't have these two chemicals to react to produce this one, you're never going to get this one. So you need the chemicals and the vitamin to make the reaction happen, and then they will produce this good chemical or structure that you need for immunity. So you need more than vitamins. You need these chemicals as well. These are what we call substrates or reagents in the chemical reaction. What are these? Now, these are substances that occur in your body that you need, but they can be lower than you need. And there's various reasons why a person's immunity goes down. I don't want to get into that in this video either. But for example, one example, stress can reduce immunity, reduces the chemical that you need, so the third one doesn't exist. You don't have enough of the third one. So this is what supplementation is. Supplementation means you're going to take the amount of something, and by adding something to it, make it more. And so you need to increase the amount of these chemicals here that will make the third one that you need. And this is what supplementation is, and you need to supplement as well as vitamins. The vitamins might appear to work quite well because you will have some of these chemicals in your body to make the third one, but it might not be enough. You might not get enough of the third one, and this reaction can only happen as far as there's chemical reagents to take part. Then you've got all these vitamins that you paid a lot of money for intravenously that have got nothing to do, so the body just gets rid of them. The vitamins without the supplements are not very effective. So, how do we supplement? How do we increase these chemicals that will make the great chemical? Well, again, there's various ways of doing it, and I'm not entering into this. Is not a long video about everything. Just for example, just a good healthy diet will give you enough of these reagents to keep your immunity up. But then you also need the vitamins to keep this, to enable this process to take place. You can also supplement your diet, in other words, add to your diet of certain chemicals. And so you can do this in two main ways. Or three if you count improving your diet. But you want to add to the diet, so you do it in two ways. One is orally. You can take these chemicals in to boost them. But one must be careful with oral supplementation. First of all, there are various ways of doing it. You can take these things in shakes, you can take them in liquid form, tablet form, capsule form, whatever. But 3 things you must know. There is no way that you can possibly know that what the bottle says it has in it actually has that in it, in the amounts. For example, a capsule is a small thing. There are products on the market that promise you they've got 50 products in one capsule. Now that's really not physically possible or pharmaceutically possible to get all those chemicals in meaningful amounts into one capsule. So what's the result? You take that one capsule, you think, oh, I'm getting 51 of something of 50 chemicals. But it's little bits like this of each one so they can fit it into one capsule. Meaningless. You've got to watch the quality supplement that you take. Secondly, the other quality of the supplement is it formulated to be absorbed? Not everything that you take in gets absorbed out of your stomach and your intestine, your gastrointestinal tract. There are certain things that don't get absorbed, certain things that can't get absorbed, and certain things that are formulated to get absorbed better. And some things have to work together. Sometimes you need a catalyst to have these things absorbed. So, whatever strange chemical or formulation you take into your body, you must make sure that it's formulated to be absorbed. How are you going to know that? Well, you've got to be a pharmacist or a pharmacologist to know which is the best formulations of, let's say, magnesium to be absorbed. There are hundreds of forms of magnesium. You've got to know which one gets absorbed the best. And so you've got to watch what's in your product, and there's no guarantee of knowing that, and you are not sure about what's the formulation for something to be absorbed. Now, let's say it does get absorbed well. Everything that gets absorbed from your gastrointestinal tract, from the bottom third of the esophagus right onto your rectum, everything that gets absorbed out of that intestinal tract gets absorbed into the blood of the gastrointestinal tract. That blood goes straight. No detours, no stops along the way, no nothing. It goes to the liver, which sits here. What does the liver do? First, the liver is the big filter. It removes all what it perceives to be strange, foreign, dangerous, unwanted, whatever. Removes that all and lets the rest through into the body. A good example of this is if I were to give you a drug called propranolol, which is a beta blocker. If I give you a tablet, I'm going to have to give you a tablet of 40 milligrams. If I give you the same drug as an intravenous injection, I have to give you 1 milligram to get the same effect. So what in effect is happening? You're drinking 40 milligrams, it's being absorbed because of those companies that make it have made sure it's absorbed. It gets absorbed, goes to the liver, and the liver is removing 39 of your 40 milligrams. You're left with 1 that gets into the body. I can give you 1 milligram intravenously. So you've got to watch the quality of your oral, whether it's a liquid, a shake, or whatever, makes no difference. You've got to make sure of what's in there, the content, and is it absorbable? Does it get absorbed? And then remember that whatever does get absorbed, the liver removes most of it anyway. So the oral supplementation is a way to do it, but it takes long because so little of what you take actually ends up in the blood. The best place to use oral supplementation is when your levels of these chemicals are normal or optimal and you're drinking the supplements just to maintain them. To recover from low down up to the top with oral supplementation takes long and sometimes never happens because you just can't get the stuff supplemented well enough just by taking it orally. So what's your other option? The other option is to take these supplements intravenously. Anything given intravenously bypasses the liver, is not extracted by the liver. The full dose that is given intravenously gets to the body. So even your vitamin drips, you're getting all these vitamins. The liver's not removing any. You're getting this wonderful boost of vitamins that have got very little to do. They all hang around, maybe catalyze the odd reaction here and then all get excreted. The supplements also need to be given intravenously, and they are there for immediate use. The only thing restricting that is their absorption into the cells out of the blood. What do we need to supplement in the body? Remember these two chemicals here that become the third one? What do we, for the immune system, what do we need? Well, we need minerals, we need amino acids, we need antioxidants, we need short-chain fatty acids, and we need sometimes platelet-rich plasma with its wonderful growing factors and healing factors. It can sometimes work wonders for your immune system. It does increase certain factors like your insulin-like growth factor, don't worry about it, which can improve your immunity as well. So intravenous supplements are the best way to get your supplements to recover. So the best situation to have is to have supplement drips and vitamin drips. The vitamin drips can be a lot less than they are, because they only have to catalyze the reaction and then they get excreted. The supplements are the thing you want, because they build up this third chemical or product or structure that you need for a good, healthy immune system. And this reaction of these two combining with each other to make this one might not happen if you don't have the vitamins. So the catalyst. And so the best way is to boost your supplements and some vitamins. Notice the emphasis, not a huge lot of vitamins with a few supplements. Boost your supplements with a little bit of vitamins. Now, supplement drips are not fast food. They're not a drive-through therapy. Some of these vitamin drips are, you pull in there and get a drip up, and your drip is in less than 20 minutes and off you go. Really? Does that not raise eyebrows? Getting a supplement drip is going to take longer. It can take up to 2 hours, depending on what you get. How do you know what you should get? We can test it beforehand. It's not always necessary to do the test beforehand. You can supplement a couple of times and then test. But you need, this thing should be done in a controlled fashion. So, how many supplement drips will you need? I don't know. I don't know how much of the stuff you have in your body at the moment. Some people might only need one drip a month. Some people might need one a week for a month and then one a month. Some people might need one a day for 5 days, and then one a week for 5 weeks, and then one a month. It's difficult to say until I have seen the patient or until the patient has been evaluated. Interesting thing about medicine, everybody's body is different and everybody reacts to everything differently. There's not one drug in medicine that everybody reacts to every time in the same way. It just doesn't exist because our bodies are different and they're genetically different. And as soon as somebody says to you, this thing, this gadget, this medicine, this whatever, this device works for everybody, back off, because you know it's a gimmick. There's no such thing that works the same for everybody every time, 100%. So I can't tell you now how much you need because you will be evaluated individually. So if you come to the Raath Wellness Innovations Clinic, you can be evaluated, or you can choose to be evaluated, blood levels taken later. Not everything that you need can be measured in the blood, but we will measure what we can when we need to. maybe not in the beginning, and we will boost your supplements so that you have the building blocks to make the good immunity. And the vitamins will just help that process. The vitamins are not an end in themselves. They just help the reaction and then back off, like the young guy introducing his brother or his sister to his best friend. So at the Raath Wellness Innovations, you will get supplements and vitamins, hopefully in the ideal combination for you. Please give us a call if you're interested in more information on 012 344 198.